So here we have Po, Ree, Nick, and Paul. Po, Nick, and Ree are founders of MedMe Health. Their platform is empowering pharmacies to move beyond pill dispensing. And Paul was the CTO and co-founder of Human Interest. He made paperless 401k for small and medium-sized businesses. And now you can take it from here and I will go away.
Awesome, thanks, Juan. Hi, everyone. My name is Priya, or Po, and we are MedMe Health. The $1 trillion pharmacy market is shifting. With Amazon delivering meds and automation, pharmacies are going to lose 80% of their revenue that's traditionally from selling drugs. But we see an opportunity for these highly skilled clinicians to focus on what makes them indispensable, and that's caring for their patients. And these are through paid services like point of care testing, giving vaccinations, prescribing medications, and monitoring their chronic conditions. But their outdated software was built to sell drugs and sucks at helping pharmacists care for their patients at scale. And so we're building the next generation pharmacy operating system to empower pharmacists in creating a more proactive and sustainable healthcare system for our aging population. Over the last year, we've pivoted twice and have grown exponentially as a result. Currently, we're live in 143 pharmacies across Canada, supporting COVID testing, virtual pharmacy consultations, as well as the incoming flu season. Moreover, in the past week, we closed deals with 3 major pharmacy enterprises that collectively represent over 700 pharmacies across the country that will go live next month. With these contracts, we're going to break 60K in MRR by the end of the year. Right now, we're raising $1 million seed round, of which we have $500,000 committed to fuel serving these contracts, scaling, and expanding our offering. The market we're tackling is a $15 billion global market, and we're starting with the 70,000 pharmacies across Canada and over a dozen US states with similar legislation, including California, Illinois, and Ohio. We are a mighty multidisciplinary team of passionate pharmacists, product designers, health informatics strategists, and software engineers. And we're lucky to be supported by key pharmacy and insurance leaders, as well as a world-renowned digital health entrepreneur with an 8-digit exit with Eric Tobel. I have a background in health informatics, data science, and government consulting to help MedMe navigate compliance, regulatory, and data architecture. Ree holds a Doctor of Pharmacy and has co-authored nationally accredited pharmacy programs. Nick brings his deep background in engineering, design, and previously helped design the Tesla Roadster and the semi-truck. We're building the operating system for the future of pharmacy care, transforming today's dispensing location to tomorrow's community healthcare hubs. Our vision is to enable adaptive treatments and foster truly proactive, preventative, and personalized pharmacy care. We're the right team building an industry-shifting product at the perfect time. And we're so excited to invite you all to join us in reimagining pharmacy care with MedMe Health. Thank you so much.
Awesome presentation. Thanks, Nick. Thanks, Po. I've been really excited to see MedMe's growth over the past few months throughout the Fight the Virus batch in the XX Accelerator. I know you've gone from kind of like selling to large clients and independent pharmacies to really doubling down on getting to not just large clients, but actual like nationalized chains. What do you think enabled that access? Do you think it was something inherent about your product, or kind of some of the shifts we're seeing in the market were accelerated by COVID? And how do you see that continuing to shift as time goes on?
So I think there's a few parts to this answer. I think that COVID definitely accelerated this idea of appointment-based services in pharmacies, but our access really came from the thought leadership that we've kind of been building over time in this space. We've kind of been thinking about this before COVID and building a product for it. And when COVID happened, the interest for something like this went sky high. And so all of the blogs and thought leadership that Ree and the rest of the team have been pushing really got the ecosystem very excited about what we were building. And when the need was there, we were there to serve it. And so that's kind of why we feel, we had been researching this so much before, but I think our base product is now serving a need, and the product, as we expand out our product, we really think that this away from dispensing towards community healthcare is what we're going to see in pharmacies going into the future.
Nice. Ree, did you have something to add there?
Yeah, I think that in many industries, industries that are often very slow to move, COVID was a catalyst. And this was the case in pharmacy, where the digital transformation in pharmacy care really came to a head over the last few months as social distancing measures were implemented and pharmacies were scrambling to digitize their offerings, including digitizing traditionally services that were on a walk-in basis. And that's kind of why we've been able to serve the need as one of the only pharmacy-specific platforms that currently exist, as well as the more immediate need in the flu season coming up, as well as COVID testing across the country. And so we're hoping to use this opportunity to prove to pharmacies that this is the new model of care. And once they've gotten onto our platform, they can see that they have so much more opportunity to expand even beyond what they're doing now and be able to offer a lot more with our software.
Amazing. And one thing I really like about MedMe too is that you're not just going to acquire many more clients, many more pharmacies, but also deepen your relationships with each one. I know you've mentioned that your product is designed to be modular or modularized. And as pharmacies kind of dip their toe into this kind of new world of providing services in addition to dispensing, they can offer more and more services through the MedMe platform. I don't know if you want to talk a little bit about that modular architecture, kind of how you came about to building it, and some of the growth you can expect as you kind of double down on that strategy.
Yeah, sure. I can speak to it from the product side. So there's a lot of players in the space that are providing value and revenue opportunities for pharmacists. And on the other hand, every single pharmacy we've learned is different. It's really hard to build a single pharmacy platform that fits every single pharmacy's need. And so these two things combined, we've decided to make a very modular approach of an operating system that can take in all of these different players almost as if it was like a marketplace, so that each individual pharmacy can choose which services they want that fits into their workflow. And I think even right now, like we barely tried and we got a cohort of around 5 players who are interested in expanding into the pharmacy space. And this is just going to grow in the next years to come. Yeah.
Very cool. And that's something I loved hearing, in our weekly office hours, how you could really get started with the pharmacy very easily. No HIPAA integration, like we're just booking vaccine appointments, right? Or just booking COVID test appointments. And then before you know it, they're hooked and there's an easy upsell there. This business, I think, really stands out as one that has the ability to grow rapidly, both horizontally and vertically in a short period of time. In fact, right now, it sounds like we have $60,000 of MRR, which is incredible. I just want to, make sure we highlight that for our viewers and see how quickly that came to be. Of that 60,000 of MRR, how much of that is new business closed in the past 3 months?
Yeah, it's really exciting. So, when we started the program 3 months ago, we were doing like outbound calls and trying to educate pharmacies on this little project that we're working on. And then very quickly, a lot of this just it was a big J curve. We started getting pharmacies on. By the end of last month, we were first, in 50 pharmacies, then more, then we got to 100. And then very quickly, we started getting these enterprises knocking on our door. And quite literally in the last 3 weeks, we've closed some of the largest pharmacy enterprises in Canada. Well, one such that's one of the biggest ones. And so what's exciting about that is that, we believe that we're changing pharmacy as a profession, not just one kind of client or another kind of client. We really believe that we're democratizing almost state-of-the-art software for this profession. And, whether you're an independent owner or a pharmacy operator of an enterprise, we will work with you and we're going to reimagine this future of pharmacy care together.
Amazing. And I know the growth is just beginning. I think, speaking as an investor, this strikes me as an opportunity where a little bit of capital can really go a long way towards scaling. That it feels like you've kind of finally hit that moment of truth with your customers, where you figure out what they want, and it's just time to kind of start expanding into that market. Mm-hmm. I am curious, where do you see yourselves by the end of 2020 in terms of customer adoption or revenue, just to kind of keep up with this rapid growth that we've seen over the past few months?
Yeah, so I think that by the end of this year, it's funny. When I would tell my team 3 months ago, like we're going to be in 500 to 1,000 pharmacies by the end of this year, and a lot of my team would be like, okay. And then, right now we are locked in for over 700 in September, and we think by the end of the year we'll probably be really close to that 1,000 pharmacy target, and that is probably closer to 80K in MRR, hopefully, give or take, depending on the contracts, but. Really
Wow.
exciting times for us. So we're growing fast, and we need to fuel the rocket because it's about to take off.
Yeah, I don't think 1,000 pharmacies is crazy for you at all, especially seeing the growth that you've had. I'm going to be really excited to watch your progress. It's been inspiring so far to see how quickly you've grown over the past few months, and how quickly you've adapted to this post-COVID world, offering services to pharmacies that are sometimes often brick and mortar businesses. Well, I think that's all the time we have, but thanks so much for taking the time out to answer some of my questions today. Really impressed by MedMe, and it's been a joy working with you over the past few months inside of XX. So.
And it's been our pleasure being part of the program. We got so much out of the XX program, not only from you, Paul, but all of the other incredible mentors and the community around us. And it's an experience that really changed us as people, as founders, and we're really grateful. So thanks a lot.